Welcome to another episode of Weight Loss with Dr. A.
Hello, and welcome to another episode of Weight Loss with Dr. A. I'm Dr. Alvarez with Endobariatric.com, and thanks so much for being here. On this episode, I wanted to explain a little bit about who is a good candidate, who is an ideal candidate for weight loss surgery. You must understand that not everybody can have weight loss surgery. You need to actually be able to have a certain criteria, and this criteria, you go to a good doctor, certified doctor, a doctor that does this daily. He or she will go by a criteria that is established by either two sources, two main sources. One is the IFSO, the International Federation for Surgery for Obesity, and the other one is the ASMBS, the American Society for Bariatric and Metabolic Surgery. These two organisms will practically dictate the criteria on who would be a good ideal candidate for weight loss surgery and who isn't. Now, I can point you in the right direction. I can tell you go check out the ASMBS website, go check out the IFSO website, but pretty much every surgeon that has a website will have the established criteria posted on their website, because we get this question pretty much daily. Am I a candidate? Is this good for me? Should I take this step? Now, you need to understand that if you meet the criteria, you will have and get a lot of benefit out of this procedure. The way these organisms have dictated who is a good candidate, the way they dictated what criteria is posted there, it is actually extracted by thousands and thousands of patients and thousands of studies that have been done to actually establish this criteria. If you meet the criteria, believe me, you will get a lot of benefit out of this. So, pretty much, I'm going to round it up with two things. There's two ways to be eligible for weight loss surgery. Number one, let me back up a bit. Let me tell you a little bit about the body mass index, the BMI. Body mass index is very important on establishing if you are a good candidate or not. So if you don't know how to get your BMI, your body mass index, you can go to my website. There's a BMI calculator right there, or just Google BMI calculator. A whole bunch of them will come up. And just go ahead and enter your height and your weight. Press enter and you'll get your BMI. Depending on that number, which is very important, again, to establish who's a candidate and who isn't, if your BMI, if your body mass index is over 40, you're going to be a good candidate for this procedure. Now, a BMI over 40, the category is named morbid obesity. Now, you don't have to be in that category to be eligible for weight loss surgery if you have comorbidities. This means sickness or health condition that is related to being overweight. And if your BMI is about 35 or over, and you have any comorbidities, medical conditions related to being obese, talking about diabetes, high blood pressure, cholesterol, lower back pain, sleep apnea, swollen legs, venous insufficiency. I mean, I can go on and on. These conditions with a lower BMI of at least 35 could make you a candidate for weight loss surgery. So it's pretty much rounded up in two: BMI over 35 with medical conditions, or BMI over 40. Notice that I mentioned you may benefit, you may be a candidate, because the ideal thing to do is to touch base with a bariatric surgeon and analyze your particular case, because you're special, because everybody is different, because we need to make sure this is the right step for you. In our case, whenever we get health histories submitted, you can always submit a health history with us. I personally review each and one of the health histories, and then I'm going to email you with your situation, your particular situation, on knowing if you're a good candidate for this and what you should do if you should take the step and what to expect after surgery. So my best advice is check your BMI. 2, check the criteria. 3, touch base with a bariatric surgeon to orient you and tell you if this is a good path for you to take and to follow. So pretty much that's it, but it's something that we see quite a bit. We get a lot of questions daily on talking about, is this right for me? If it isn't, we get a lot of patients who shouldn't even be looking into this, that are just a few pounds out, have a few pounds up, and they're thinking this may be for them. No, diet and exercise may be a good option for them, and weight loss surgery may be just too much for them. But if you have doubts, contact us. We can help you out, certainly, and my coordinators will be helping you out, knowing if you're a good candidate for this. So I hope this helps. That is another episode of Weight Loss with Dr. A. And if you have any topic that you might want us to talk about or explain a little bit more, go ahead and let us know via social media. Take care and God bless.
If you're interested in knowing more about the gastric sleeve, visit endobariatric.com.